News release. Wednesday, September 27, 2023. Awards to community organizations will enable examination of structural drivers of health. The National Institutes of Health is funding a first-of-its-kind community-led research program to study ways to address the underlying structural factors within communities that affect health, such as access to safe spaces, healthy food, employment opportunities, transportation, and quality health care. Through the National Institute of Health Common Fund Community Partnerships to Advanced Science for Society Compass program, National Institute of Health made 26 awards to community organizations and a coordinating center, totaling approximately $71 million over 5 years, pending the availability of funds. Through these awards, Compass will enable research into sustainable solutions that promote health equity to create lasting change in communities across the nation. National Institute of Health is directly funding research projects led by community organizations. Leaders from the organizations will work in collaboration with their research partners at academic institutions and other organizations in all phases of the research process. Compass projects study social determinants of health of the social, physical, and economic conditions where people are born, grow, live, work, age, and play that contribute to health inequities. The Compass research model harnesses diverse perspectives and expertise to examine systemic factors that impact the health of individuals, communities, and populations, said National Institute of Health Acting Director Lawrence Tabak, DDS, PhD. We are excited to see how results from these awards exemplify the transformative power of community-driven research. The projects will examine underlying conditions and environments that influence health outcomes by enabling the development, implementation, and assessment of structural interventions. Structural interventions are meant to alter social determinants of health by changing factors that create differences in opportunities to achieve optimal health. Each award will foster the design of strategies to improve health outcomes through innovative structural interventions to address community concerns such as economic development, social and community context, neighborhood characteristics, health care access and quality, and nutrition and food environment. Community organizations and their research partners will work together to develop a structural intervention, launch it within their communities, and then assess whether the intervention improves health outcomes. Several examples of Compass-supported research projects, which focus on populations that experience health disparities, include National Institute of Health will gain valuable experience and insight into how to support successful future community-led health research. Each project will also contribute valuable data to a growing body of knowledge about social determinants of health and structural inequities. The Compass program is funded by the National Institute of Health Common Fund and managed collaboratively by National Institute of Health staff from the Common Fund, National Cancer Institute, National Institute of Mental Health, National Institute on Minority Health and Health Disparities, National Institute of Nursing Research, National Heart, Lung, and Blood Institute, and National Institute of Health Office of Research on Women's Health, with many of the National Institute of Health institutes, centers, and offices providing input and participating in program development and management. More information is available on the Compass program website, https://commonfund.gov/compass. To learn more about Compass, watch this brief video, https://www.youtube.com/watch. V = PVQ Vic 6km. About the National Institute of Health Common Fund. The National Institute of Health Common Fund encourages collaboration and supports a series of exceptionally high-impact National Institute of Health wide programs. Common Fund programs are managed by the Office of Strategic Coordination in the Division of Program Coordination, Planning, and Strategic Initiatives in the National Institute of Health Office of the Director in partnership with the National Institute of Health Institutes, centers, and offices. More information is available at the Common Fund website, https://commonfund.gov. About the National Institutes of Health. National Institute of Health. National Institute of Health, the nation's medical research agency, includes 27 institutes and centers and is a component of the U.S. Department of Health and Human Services. National Institute of Health is the primary federal agency conducting and supporting basic, clinical, and translational medical research and is investigating the causes, treatments, and cures for both common and rare diseases. For more information about National Institute of Health and its programs, visit www.nagov. National Institute of Health Turning Discovery into Health Registered.